Greetings to everyone. This is your host Ash Khan and you are watching Consumer Pakistan News Channel. In today's bulletin,
Prime Minister Imran Khan tests positive for COVID-19. According to Special Assistant to Prime Minister on National Health Services, Regulation and Coordination Dr. Faisal Sultan, Prime Minister Imran Khan has tested positive for the coronavirus today. He shared the news on Twitter. As the Prime Minister is above 60 years old, he was vaccinated under NCOC guidelines 2 days ago. It is possible that he contracted the virus before he was vaccinated, but it hasn't been confirmed yet. It should be noted, however, the vaccines don't prevent infection but rather strengthen your immune system through antibodies. COVID-19 antibodies could take up to 28 days to develop after the first shot. When vaccinated, one could still get infected, but the severity of the disease wouldn't be as ugly as it could be without vaccination. Cabinet approves Rs 5.65 per unit increase in electricity prices. The Federal Cabinet has approved the promulgation of an ordinance to increase the power tariff by at least Rs 5.65 per unit. The Cabinet has approved an emergency summary to increase the power tariff by a minimum of Rs 5.65 per unit from now until October to collect Rs 884 billion from consumers. The Rs 5.65 per unit increase will cause a surge of 36% in the electricity bill, excluding the impact of taxes. This step has been reportedly been taken to prevent the International Monetary Fund program from crumbling. Meanwhile, the electricity rates are also expected to increase by 65 paisas per unit. Punjab government to construct 3 murla house for low-income people. Punjab's Minister for Finance Makhdoom Hashim Jawan Bakht announced that the provincial government is constructing 3 murla houses for low-income people on semi-rural areas on land belonging to the government as identified by the Board of Revenue. The minister presided over the 54th meeting of the Cabinet Committee on Finance and Development at the CM Secretariat and said that the government of Punjab is giving the homeless an opportunity to own private houses on easy installments. The provincial government has collaborated with the New Pakistan Housing and Development Authority, the Bank of Punjab and other banks to construct these affordable houses. SPI dipped 0.19%. Continuing with declining trend for the second consecutive week, the sensitive price indicator-based weekly inflation for the week ended on March 18th for the combined consumption group witnessed decrease of 0.19% as compared to the previous week. The SPI for the week under review in the above-mentioned group was recorded at 146.86 points against 147.14 points registered in the previous week, according to the latest data of Pakistan Bureau of Statistics. Meanwhile, the SPI for the consumption groups from Rs 17,732 to Rs 44,175 and above per month decreased by 0.11%, 0.15%, 0.20% and 0.22% respectively. During the week, prices of 9 items decreased, 22 items increased, while that of 20 items remained constant. Health Minister stresses upon safe disposal of hospital waste. Punjab Health Minister Dr. Yasmin Rashid has stressed on the safe disposal of hospital waste chairing a meeting on hospital waste management held at the Specialized Healthcare and Medical Education. She directed the officials to prepare a revised strategy for the disposal of hospital waste. The minister reviewed process of waste disposal at public sector hospitals. Dr. Yasmin said that the PKLI had microwave and Children Hospital had incinerator facility. She added the incinerators were being procured for Jinnah Hospital Lahore, Institute of Mental Health Lahore, and others. She said that the incinerators were available at 26 DHQ hospitals of the province. Dr. Yasmin said that the yellow rooms had been set up in all hospitals of Lahore. She said that measures were being taken to review arrangements at public sector hospitals.
Thank you for watching Consumer Pakistan News Channel. This is I, Ash Khan. See you in the next bulletin. Until then, take care and goodbye.